I've known Paul Nielsen for a long time. He was an entrepreneur that I worked with prior to him going to United Healthcare, Optum's group, and he's been a key partner for us at the Carnegie Mellon Corporate Startup Lab. And recently, he's helped me get to know the folks at General Catalyst, and it's a storied venture capital group. So I'm going to just kind of quickly introduce both of them because you may or may not know General Catalyst and Optum, but you certainly know groups around both of them. So for General Catalyst, even if you don't know the venture capital firm General Catalyst, you definitely know the portfolio companies that they've backed. They're kind of invest across the spectrum in terms of stages, and they've invested in companies that you would know, such as Warby Parker, Airbnb, Stripe, Kayak. That's a pretty good track record, and I'm actually leaving a bunch of famous companies like HubSpot off the list still. Chris leads their healthcare practice there. He's actually based in London, so we're continuing with this theme of guests from Europe joining the second day of the Corporate Startup Lab Forum. And then Optum for a moment. If you don't know Optum, it's the largest software company you've never heard of. They did $136 billion, $136 billion with a B, dollars in 2020 in revenue. For perspective, this is multiple sales forces of revenue. Yet I doubt anybody on this call doesn't know who Salesforce is, and there probably are people on here who are not familiar with Optum. So great leaders coming to talk to us a little bit about innovation in the healthcare space. We've already talked about innovation in banking, innovation in the consumer packaged goods space, and we want to talk about healthcare as well, because when we put this agenda together for the forum, it was obvious that in terms of these industries that have been transformed and aggressively transformed over the last couple of years, healthcare was critical. So really excited to have Chris and Paul join us today. Chris, I want to start with you, and guys, we'll continue to monitor the chat here. So feel free to ask questions there. I want to talk about what you want to talk about, but I'm going to kind of start the conversation. I'll keep an eye on the chat as well. So Chris, let's start with you. So General Catalyst is on the record as saying you can't disrupt the healthcare space. You have to radically collaborate with it. And so I guess as the guy who leads the healthcare practice for General Catalyst, I'd ask you to kind of double click on that and elaborate a little bit for us.
Thank you, Sean, for having me, first of all, and glad to be on, and hope we can provide some insights. So I guess what we're trying to say is that you talk to an individual, no individual is going to say they want the healthcare disrupted. And whilst in a consumer sector, maybe you do want disruption, and that is the way that new businesses are created. But given the size, the complexity of the healthcare system, how highly regulated it is, with a risk to human life, you need to be kind of intentional on change. And so our thesis is you need to collaborate with the ecosystem. You can't just rip it out and start afresh, as sometimes happens in technology. And our approach is we're not just trying to help create technology companies or sell technology into the system, but partner with the system to help it transform itself. And I think we're at a stage of innovation in digital health where that's possible. I think some of the first wave of digital health companies, like a lot of disruption or innovation in other sectors, sort of happen outside the system. And I think we're now at a more exciting stage where it's more integrated and the outcomes are going to be stronger for that. So, that is our approach. We sort of kind of also say the deliver change of the scale that needs to happen, it's going to take a lot of actors. And, for one, in terms of healthcare, we have somewhere near 60 investments in various businesses across stages, from early businesses to companies that have gone public, like Livongo, and got sold. And I sit on the board of Teladoc. And, hopefully we can create this movement for change that will deliver, the triple aim of healthcare.
Awesome. And Paul, let's go to you as well. So you had and again, I wanted to stay for just a moment on this, how healthcare innovation is different. So Paul, you had a storied career as a traditional entrepreneur, right? Working in a bunch of different industries. And then 6 years ago, went to Optum and United Healthcare Group as this corporate entrepreneur, kind of change agent inside UHG. How do you think about healthcare being different from the places that you've been responsible for innovation in the past?
Great question, Sean. So, I can echo what Chris said, that you just can't wholesale rip out the current infrastructure and process and exchange it for something new. It's not like the film industry where we took the physical DVD off the shelf and digitized it and made it available through a myriad of digital marketplaces. The impact is on health and health in lives. So it's much more complicated. And it's also more complicated in how the contracts work between providers and payers, providers and hospital systems, employers and payers, and then of course us as consumers and wherever we're consuming where we're subscribing to for a health plan. So it is much, much more complicated. And that being said, it is much more difficult to break in, from the industries. Mostly I was in telecom and Hollywood broadcast. There are certainly a lot of regulatory requirements there, both from the FCC, but also the studios, the publishers, license rights, all kinds of, of contracts there, but not nearly as regulated as we have in healthcare. And you just can't open up a new store, so to speak, and just start advertising to have people come to the store and receive care. It doesn't work that way because providers don't have to accept your claim, right? Or I should say payers. So it's much different. And what I found is it's a much longer ramp that you need as a startup to get into the industry. You need a big brother. When I say that, United Healthcare or Aetna or Humana, somebody who's already in the industry and can give you access, controlled access to the pieces of the industry that your product service is related to, so that you can go through a pilot. And if it needs FDA approval, that's one ramp you have to go down. That takes time. There's always security concerns around PII, PHI. So you have to make sure you adhere to whatever certifications, to ensure that your data is kept private or the individual's data, et cetera. And that just takes time. And from a traditional startup and investor, you need the right investor behind you that is willing to walk that journey with you, because it's not a quick hit. It will take time and investment to get there. And then because of the complexities, you do need that big brother that can help you navigate the system and introduce you to the right people that can elevate you and can get you into those real pilots, right?
Just going to say, Chris, it looked like you wanted to jump in.
Great points. And I think one of the things that I just reflected on as Paul was speaking was, I think you have to think about as an entrepreneur, which channel you really want to go to. The go-to-market is so important in this sector. And I think, the self-insured employers, not just the large and increasing the mid-size and the smaller groups, want innovation. And I think that's a clear pathway to start certain services businesses, technology-enabled services businesses. And I think you're now in a world where, when I think about, we were building Livongo 5 years ago, you needed the PBM partners to get it in, right? You just impossible without some big brothers, to the point was previously made. I think now, actually, Fortune 100 company, they've got a team that can assess and, send an RFP, and you as a startup have a chance, right? But some of the other, books of businesses or channels are just a lot harder to get to and need more time and also more proof of efficacy, right? This is an industry where we need to drive ROI, and, there's a chicken and egg problem for entrepreneurs that unless they have clients, they can't prove their efficacy, and et cetera, et cetera, et cetera.
And great points. And it's interesting. I was on a panel yesterday, an internal panel with CIOs and the head of our Optum Technology CIO. And we were talking to it was the Academy of Technology monthly lunch and learn, our own Academy of Technology. So these are our brightest technologists throughout the enterprise. And one of the things we were talking about is the industry's going digital therapeutics, it's going more retail, consumer driven. That's a new direction for us as an industry. We're not used to that, right? So we're trying to share with our technologists, you need to look at things differently, right? But to Chris's point, we need to pick certain areas to start in. You can't just boil the ocean here. So in care delivery in itself is a very broad area. There's a lot of new digital therapeutic companies are out there, startups that are offering their services, via a subscription model or something that, through telehealth, right? Telehealth is the direction everybody's heading down. So, and in that, it's very broad, moving the clinic into the home. I always look at things from a silver lining perspective. The silver lining for COVID was it just blew away all of the, whether regulatory blockers or, just sheer fear of security, losing PHI, PII by offering telehealth services. So now that, in the US, the US consumer of healthcare, after many surveys, they do not want to go back to the traditional schedule appointment, drive to your provider, sit in the waiting room, have your, whether it's a wellness or illness, if you're symptomatic of some sort, and be seen and then, be directed to the next step. Today in 60 seconds, you can be on a telehealth visit with a nurse or LPN doctor, and whether that's a wellness or an urgent care visit. And that is so much more efficient for everybody in the ecosystem. So anyways, just getting back to the point, we're being very focused on where we can make change now. And also we have to keep in mind that the revenue model here is regulated, right? Now, at United Healthcare we, as a group, we are in every part of the healthcare ecosystem. We are the largest payer. We have a very large growing care delivery organization. We have over 80,000 medical doctors on our payroll. We have Optum Bank, the largest bank that trust for HSAs. Optum RX, which is the third largest PBM. I could go on, right? So that being said, we have these existing P&Ls that have to be maintained. We're a public company, so we have to keep our shareholders in mind. So when we look at new technology, we're not just creating something new for the sake of it being new. It has to have some benefit for the business, and as well as get us into this transformation into a digital domain. So that's something we have to work on internally, especially as a technology organization, keeping in mind the business needs. Because, an example, if you put out a new server and it may have 3 times the throughput and twice the storage, but if it doesn't either enable new customers, new revenue, or reduce the cost of operations, or some other benefit, or the cost of ownership on a year-to-year basis is neutral, like doesn't add any revenue, then we shouldn't do it, right? The business is going to say, why would I do that, right? Or is it's not going to increase NPS. So this is an NPS. Now we're more consumer driven. We have to really look at that, right? We have to do A/B testing and see how the consumer is behaving with these new digital services. So that we have to be very, very specific in what we invest in.
Really amazing. Like, I think it's brought a lot of this to life. But maybe, Chris, to make this sort of multi-party radical collaboration thing just a bit more real, you could talk about an investment that you guys have done that kind of embodies this philosophy.
Absolutely, Sean. So maybe Commure is a good example of this. And this is an interoperable platform that aggregates disparate data. And I think, as we all know, in healthcare, for a number of reasons, information was fragmented, siloed, and trapped effectively in different areas. And so in other industries, when you've looked at sort of the real creative initiatives, the internet being a good example, information flowed, and that led to lots of opportunities and, frankly, business creation that lowered the cost of lots of products and services. And so what Commure does, it integrates into the patient layer, into the healthcare experience, provides an end-to-end view of the patient. It's an interoperability platform, and so it has to connect. It's only as good as the connections it has. And so by definition, to your point around radical collaboration, a platform like that has no utility unless it's adopted. It can work with traditional companies, it can work with startups. With the idea is it provides all these insights, all this data that turns into insights for different stakeholders, whether they be providers, clinicians, IT personnel, informatics people, operational people, in a much more holistic way than perhaps traditional software was built to do. We know the constraints around the traditional EHR systems. So we're excited about that. We have partnered, with a number of players to adopt it, and we see hopefully it's a platform that can lead to this transformation over time. And not to draw parallels that are perfect, because there aren't in healthcare, but in other areas, whether it's AWS, whether it's Shopify, whether it's Stripe, platforms have been built on which companies can then be built that thrive. And I think one of the challenges have been in healthcare is a lot of companies have built their own stack end to end, and no, there's never been really third-party tools and software that you can use to build companies. And wouldn't it be great if there were more of those solutions in healthcare, that you could see the sort of profound impact you've seen from these platforms in other areas of the economy? And so Commure is an ambitious attempt to do that in part.
So are people building stuff do you see companies
Yeah,
being created
absolutely.
on top of Commure today?
Absolutely.
Okay.
People, startups are coming to us and say, well, hang on a second, we've got a great idea for X, right? We got the care delivery side. We come from that background. We know that cold, but building the tech platform to support that. And we realize, let's say, we mentioned hospital home, that's complicated. There's a lot of integrations that need to happen. Well, can we just build it on Commure, right? And so that's going to shortcut some of the technology infrastructure innovation that needs to happen, right? And so that means hopefully product can get to market quicker, to be tested quicker, either succeed or fail quicker. And that will speed up innovation. Yeah, absolutely. We're seeing that. And that's the purpose of it.
Paul, sort of shift it back over to you. I don't know if you want to build on that model or talk a little bit around some other models you developed, but I'll kind of hand it over to you to react to that as well, because I know you're very familiar with Commure.
I can build on that and maybe talk about the Optum Startup Studio was something you and I have done together and how that works into that ecosystem. So, and I look at the healthcare industry as a whole, similar to, what our needs are as a platform to banking. And I say banking, they've done this already, right? Banking has done what we need to do 10 years ago. So if you look at banking, you go to Fidelity or, whatever bank your bank is, they're all pretty much now equal in terms of capabilities, right? You go in and you go to their web portal, their platform. Essentially, you have your retail banking, your consumer banking, where you have your checking account, savings. That's one business, as you know, within banking. Then there's the mortgage loan area. That's another business by itself, right? But again, accessible on this one nice platform, right? And then there's investment, which is yet another business in banking. But again, they make it all accessible on one platform, and underneath, your personal information can be shared across those lines of businesses. To Chris's point, in United Healthcare is no different than anybody else. We've built our stacks from the ground up and within our own walls, right, for the most part. And then you have the EMRs, the big ones that everybody knows about, Epic and Cerner, and then there's others who built their stacks. And when they build a provider stack versus a hospital system, they're both built purposely for each entity, and they don't interoperate naturally. You have to go back to that vendor, and they'll basically build you a proxy, which you would never think, why would that be the case? But it is. The fire standards, HL7, have come out to try to enable sharing of data across different platforms, and that's Commure is heavily built on that. So we look at Commure as the opportunity is potentially breaking out, the industry so that we can enable the like Salesforce-like occurrence in the industry where different vendors can come in with pieces and specialize in certain areas and host their application there. And then the Commure platform, which is, I look at it as the underlying connectivity layer tissue, right? That can connect those applications together to share data like between payers and providers. And then, of course, the consumer, right? So that being said, we've been certainly looking at this for a while as a company. As you know, Sean, you and I, in partnership with CSL, we launched the Optum Startup Studio 3 years ago. And, we're in our third year. We're just about to launch our third cohort. And part of the goal there is to incubate and help these early stage companies that are coming out in healthcare. They're digital therapeutics, for example, IoT, moving healthcare into the clinic, into the house. We're incubating IoT companies that may have sensing technology that will record your sleep, biometrics and things to help with sleep disorders. Could be a wearable on your wrist that's grabbing biometrics. That could then be in real time captured by a clinician who's on the other end of a telehealth session that you're having, so that they can then better determine what condition you are or what your next step is. But that is in preparation for when we as Commure is growing, and it is growing. We've seen that recently in some major announcement. I won't say that. I'll let Chris call anything out like that. I'm not here to promote Commure, but we know they're growing, and we think it's in the right direction. So we want to support that, and we believe we need to go in that direction. It's a big lift, for all of us. So we are targeting specific areas that we want to break into that industry first, and then grow from there.
All right, so let me just segue then to just kind of areas of healthcare innovation that you're particularly excited about. Given where both of you guys sit, you see a lot of innovation come across your desk. And so I'm just curious, like broadly, you don't even name a specific company, but sort of categories or or trends that you're particularly excited about when it comes to healthcare innovation? Chris, maybe we'll start with you and then Paul on this one.
Yeah, so I'd break it down to a couple of areas. I think we're at a different stage of innovation we were 5 years ago. I think 5 years ago, to be an entrepreneur in the sector, you probably need to be an established healthcare operator. I think you look at innovation in other industries, a lot of great companies are started by people who've come from without the sector, and they have a naivety, but they also, have a questioning attitude. And so I think we're reaching a point in healthcare where you can be a non-healthcare expert and build a healthcare business, which I think will be great. But I think we're tackling, areas that we hadn't before. Health equity, we're tackling it more aggressively. 5 years ago, I think that probably wasn't a subject people want to invest in. Rural health, hospital at home, some big issues that we need to deal with that are now kind of mainstream, and mainstream capital is prepared to take a punt on, can we build businesses that are transformational and that are not necessarily purely tech, but there's a tech and service. Then I think to the whole community topics, there's a lot more of these businesses that are going to be enablers, the sort of picks and shovel businesses on which other businesses can be built. And so I think I'm excited to see that. And that could be, really across the stack to help that transformation happen. I think, areas like telemedicine have gone from episodic to longitudinal, right? So, we're seeing these digital mediums, not being just used in a very, very low frequency way, but actually realizing that they need to develop a relationship with a patient, and it's not independent of a PCP, but it's a relationship-based business. And then obviously from payment models, we've clearly seen the success of value-based care in the primary care field. And we're seeing, big payers like United say, well, look, am I prepared to sort of hand over risk around certain specialty areas where people can create a medical home? And so I think that's a lot of innovation will happen in certain of these specialties as well. And value-based care, will accelerate. I think couldn't be more optimistic, couldn't be a better time for entrepreneurs to come into healthcare.
Paul, you want to take the same question, areas you're excited about?
Sure. I think telehealth as a whole can address many of the things that Chris just talked about. So, we're very involved with health equity. We have a whole organization just focused on that. And rural, the inequities in healthcare are very present in rural, but also you have a population in highly suburban, I should say, metropolitan areas, right, that have inequities in healthcare. I think telehealth can address access to care, right, which addresses those issues there. Most everybody has a cell phone today, at the very least, right? They're all smartphones. I don't think there's too many flip phones left or anything like that. So that being said, this is your visit. This is your clinic, right? So it makes healthcare more accessible and it will increase affordability, right? So I'm excited about the telehealth, and in that, the IoT space, part of what I've done in the past, and my own little garage thing with a couple of partners was around IoT, and I see that coming back actually is having connected devices. In this case for healthcare. And again, the digital marketplace having the consumer driving this, to me, excites me because I came from, the entertainment industry for 25 years. That was very consumer driven, as you know. It's more natural for me to think about how we bring these products to market. And then when I look at startup companies, that are building these products with the consumer in mind from the start, not a B2B model, again, resonates me, and I get excited, and I want to work with these companies to help them get next chasm, so to speak, so they can continue their growth. So that's the area that I'm really excited about. I think the rest of it will follow. There's certainly a lot of work to be done in the back office, a lot of automation. We are the industry keeping the fax machine alive. Thank you, all those companies building fax machines. We are you can thank us, because the volume of faxes we still use today is just astounding. So there's definitely a lot of opportunity there, but I think the consumer side and the care delivery and where that's going, to me, is the exciting part.
Fantastic. And I feel like both of your answers there were an optimistic way to end this panel, which is good. Like, we should be optimistic about bringing innovation to this space. Chris and Paul, thank you guys for joining today. It was incredibly insightful, both around what's going on in healthcare, and I think they're also for attendees in other verticals. It's great to think about how you can apply some of these to the industries that you're in as well.
Thanks, Sean.
Thank you, Paul.
Cheers.
Bye.